Today, the COVID-19 public health emergency officially comes to an end.
There are still COVID cases in Georgia, but so many fewer. The Department of Public Health reports 105 new cases over the last week, but you compare that to 20,000 cases we were seeing a week in January. Jerry Carnes of our Verify team is here to explain what these changes will mean for you, all starting today. Jerry.
Good morning, Cheryl. You mentioned some of the numbers regarding COVID-19 tests. Our access to information like that will change beginning today. Labs will no longer be required to report COVID test results to the Department of Health and Human Services. There will be other changes that could impact your ability to get a test.
You might be one of the many people who have ordered free COVID-19 tests from the federal government. 80 million families have received a total of 750 million free at-home COVID tests since January of last year. Is that going to continue? The answer is no. Now that the public health emergency has ended, the government will stop mailing out those free tests at the end of the month. The nation's supply of tests is still solid. The Department of Health and Human Services says free tests will continue to be available as long as supplies last at certain community locations. Getting a free test from the pharmacy will depend on your insurance. Some insurance companies will continue to cover it, but they're no longer required to do that. What about COVID vaccines? Can we still get a shot free of charge? The answer is yes. The CDC reports that access to the vaccines will still be available for no charge as long as supplies last. The same is true with certain treatments, including Paxlovid. What about mandates? Will the federal government continue with its vaccine requirement for its employees? The answer is no. The vaccine mandate is ending for federal employees and contractors. Private employers are free to decide if they want to issue their own mandates.
According to the CDC, hospitals will still be required to report COVID cases to the federal government through April of 2024, but the reports will go from daily to weekly. Sharon.
What an end of an unbelievable era here today, Jerry. Thanks a lot.